Hi, I'm Dr. Preggers. I am a doctor of internal medicine, and I decided to chronicle my pregnancy. I'm not here to give professional obstetric advice. However, I hope that by sharing my pregnancy or maternity questions and my joys throughout pregnancy, I will hopefully inspire other pregnant women out there. So I'm currently 12 weeks pregnant, and I'm experiencing fatigue. I'm still experiencing the nausea. I also feel like food is regurgitating up in the back of my throat and going back down. I have burping and even constipation. It's been very uncomfortable. And a lot of women have the question, well, why is this happening in the first place? Excellent question. So during pregnancy, the pregnancy hormones, particularly progesterone, not only relax the muscle at the bottom of the food pipe called the esophagus and allow food to come back up into the esophagus, but you have decreased motility in the small intestine and the colon, which leads to constipation. So there's a lot of reasons why these symptoms are happening in the first place. However, there are things that you can do to ameliorate some of these symptoms, and it's some of the things that your internist, your regular primary care doctor, can recommend or may have already recommended to you even before you became pregnant. So for example, with acid reflux, for example, so that regurgitation of food that I feel in the back of my throat and then it goes back down, mine is not associated with heartburn. It's associated with some chest discomfort and some discomfort in my upper abdomen here, which is the epigastric region of the stomach, of the abdomen. That heartburn or acid reflux that I'm experiencing can be ameliorated by avoiding certain foods. So for example, foods that have a lot of acid in them. So tomatoes, tomato paste, tomato sauce, the stuff that I absolutely love. Those things can worsen acid reflux. Coffee relaxes that muscle at the end of the food tube and brings stomach contents and acid back up. And it doesn't matter if it's caffeinated or decaffeinated, it's the coffee bean in general that worsens acid reflux. Sorry, I know a lot of my patients hate for me to tell them that because they're big coffee drinkers, but yes, it does worsen acid reflux. Also, foods that have citric acid base to them. So that includes your oranges, orange juice, pineapples, any kind of citric acid fruit or citric fruits and juices are going to be big culprits. And some people, foods that are spicy or have a lot of garlic and onion can provoke acid reflux. And so you might want to take a look at some of the cultural foods as well, which can be big culprits because they're naturally going to be very spicy. And probably tone those down a little bit and choose blander options to see if that helps alleviate your acid reflux. Some people get the symptoms with peppermint. So peppermint tea, you would think would be very soothing to the stomach, but in other people, it might worsen acid reflux. So these are just a few to name. During pregnancy, we tend to want to avoid medications during the first trimester, especially during such a critical moment in a baby's life where the baby is developing. because most medications have been studied in animals. So we want to avoid anything that could potentially affect the development of the baby, even though there are medications that are thought to be relatively safer. You still want to consult your obstetrician with regard to medications that you can use over the counter, including Tums or the antacids with calcium in them. Medications like the H2 blockers, your cimetidine, famotidine, medications like your proton pump inhibitors. Those are the Nexium class of medications, omeprazole, pantoprazole, those types of medications. You want to consult your doctor first to see if it's safe, especially if you're during the first trimester of your pregnancy. The other thing that I found very helpful with acid reflux, I actually sleep on 2 pillows that keep my head at an incline at night when I sleep, so that if I were to sleep flat, acid would back up and has actually choked me, causing me to wake up with a cough in the middle of the night. So I sleep on 2 pillows so that I'm sleeping more at an incline to prevent that acid from backing up. It helps somewhat. A wedge pillow probably would be a little bit better, or even a platform bed that allows you to move the head of the bed to about 30 degrees would be ideal. We do that in the hospital for patients all the time to prevent and help alleviate some of the acid reflux symptoms, even for those patients who are already on medication. So this is just one little tidbit that I want to share with my viewers, and I hope you really enjoyed this short tidbit. And hang in there. Bye.